have the great pleasure now of introducing to you a great friend and colleague, Simone Scaglioni, who is based in the northern regions of Italy. It's interesting, Simone and I met because my physio here in Adelaide, he actually trained and did his master's degree with another physiotherapist from Italy. And when I was asking Ben about, who do you know in Italy that could help me, he put me on to Sergio. And then Sergio said, you know what, the best person you should speak to is Simone. So it was an incredible demonstration of the global community of manual therapy practitioners. Now, Simone and I met and worked together to bring FMT to Italy in 2012. And we put on a training in Milan, and we worked together. He was my translator, and I'm really grateful for having him on this call today because he has extensive experience as a manual therapist, not only as a practitioner, but is also a trainer of many manual therapy techniques as well. So he's based in Varese, which is close to the northern mountains region of Italy. Simone, welcome, and thank you very much for being part of this call.
Thank you, Ted, for inviting me to have a chat with you from Italy.
Yeah, it is indeed my pleasure. So tell me, Simone, what is the Simone Scaglioni story of becoming such an accomplished and respected manual therapies practitioner?
20 years I'm in physical therapy, so it's a pretty long time.
Yes.
I got my degree, so 20 years ago. And when I started my profession, I started working in the sport area. So I was the physical therapy of a professional volleyball team here in Italy, and it was a great experience. So for sure, I was interested on the orthopedic manual therapy treatment area of physical therapy. And during my practicing, I met several orthopedic surgeons and so on. So my interest went on deeply on this area and organizing courses. And I had the luck to meet several people from abroad, so from USA, from Australia, from Europe, and during these last 15 years, I had the fortune to meet people like Lormer Mosley, David Butler in Australia, Mark Jones, Ola Greensby in the USA, and several other people from Europe like Andrew Fleming, Ted Jedynak from Australia, and so on. And during this period, I also took a master degree in Italy and a clinical doctorate in USA to improve my skills. And nowadays, I have my own company as well, Manualmente, through which I organize courses in Italy, taking these people from all over the world into Italy to train Italian physios. And let's say that now this is my hobby. This is my job as well. And this is my brief history.
Well, it's fantastic. And listeners, you'll appreciate the breadth of experience that Simone has literally created for himself. And it really stemmed from looking to improve his own clinical skills and looking outside the box and willing to network and get to know people from all around the world. And I'm absolutely in awe at what Simone has been able to accomplish, and also the network of practitioners globally that he has. But Simone, the thing is, you started at a point where, like so many of us practitioners, where you recognize that you didn't have all the skills that you wanted to, and so you literally went to explore other treatment options and other methodologies. So could you, I suppose, give me a summary of what value do you feel that manual therapies offers to your patients? And so, what is it you can do now and provide for them that you couldn't do when you were a new graduate?
First of all, the word manual could be confusing because we think the most important thing is the hands, of course, because manual comes from Latin, manuale,
Yes.
that means hands. But the truth is that the most important thing in manual therapy is the brain of the therapist because it's the way to clinical reason. So the clinical reasoning is the most important thing, first of all.
Yes.
So then you can start with the hand skills. But the way to think, I think it's the main difference in between different professions like podiatrists, osteopath, chiropractors,
Yes.
physical therapists. I think the difference is not on the hands, but on the way to think and the approach on the problem.
Wow. Okay. Well, that is a really insightful distinction and very important as far as it's more the why do you do what you do rather than what you actually do as far as technique goes.
Exactly.
Great. Now, look. Yeah, I think you've also acknowledged that yes, the hands are important, and that's the whole that's the tools for manual therapies. Tell me, Simone, how did you develop your hands-on skills, your tactile skills? Were there special things that you did that helped you develop those skills?
Yeah, I did mainly three things that are use your hands,
Yes.
and then use your hand, and then use your hands. I think it's something like we can say palpate, palpate, and palpate. So
Yes.
you have to do that, repeat and repeat and repeat on a daily basis with your patients. So for sure, first of all, it's important to learn from more experienced colleagues. So I learned it from experienced and really well-trained teachers.
Yes.
But definitely, the most important thing is the clinical experience. So to do that not on healthy colleagues, but to transfer it into the clinical setting and palpating different, for example, feet, hands, shoulders, because
Yes.
we are absolutely individuals.
Yes, that is great, and you've reminded me of the description of, for anyone developing any skill, whether it be sport or intellectual, it's the 10,000 repetitions to get to a point of mastery or accomplishment. But yes,
Yeah, just to become a coordinated movement, not to be automatic. So to
Yes.
be a coordinated movement, you need to repeat it 6,000 times.
Yes.
So
I see.
it's amazing.
And here we have another example of the Italian economy. He's already going for 6,000 times, even though I suggested it might be 10,000 times. But anyway, we
Exactly.
won't. Let's not talk politics or economics right now.
Forget the Italian economy.
I think many people have. Anyway, so tell me, Simone, what advice would you have for podiatrists who are new to FMT or new to any form of manual therapy? You've highlighted a very good point about the repetition and, practice and then practice some more. But if you had a new practitioner who was getting interested and excited about manual therapies and using their hands, what advice would you have for them?
I think first of all is to find a good teacher, like for example Jedynak, so to be helped by. What I mean is someone who can really give you some tricks, tips, and to guide you on finding the right way.
Yes.
Then to do it clinically, so with different people, different patients, different even ethnic people, different. But the third step should be to be correct once again from your teacher, maybe into the clinical setting. So let's say something like clinical supervision. So to be supervised while treating people. That's the most important and the most effective way to learn something.
Yes.
So I think for a new colleague, for a young person, it's important maybe to find a course or a seminar or something with the clinical setting, with the clinical supervision.
Yes, we have an English expression, practice makes perfect, but I think what you're describing is perfect practice makes perfect, because if you practice mistakes or incorrect methods, you're never going to get better doing that. So thank you, that is a good point. Simone, often when I meet practitioners who either do a course with me or with someone else, a feedback we often get is, well, I go back into my clinic, but I'm not confident that I'm doing the right thing. Should I still practice and do them if I'm at risk of doing something that's not correct? What advice would you give to someone who had that type of saying or that type of feeling?
I think it's incorrect to perform something you are not sure to be correct. So first of all is to check it in your notes or handouts or videos or whatever. But I think nowadays we are in an incredible media and social media community. So it's so easy to make a phone call or to have a chat with someone who already does that thing in a correct way. So it's absolutely easy to be corrected by a person who can help you. So find a way to be helped by someone who already knows how to perform that in the right way.
Yeah, a good point. And I know sometimes I will still research different techniques and methodologies, and you go through YouTube, and if you don't have the experience, you could be persuaded by something that looks like it, or it sounds like it is the correct thing to do, but how do you know what is the right thing to do if you just do a Google or a YouTube search? I think that's where probably the dangers of getting incorrect information might come through. So,
in fact, I won't say go on Google and find, or YouTube, and you will find the correct way, because otherwise you will perform some Google therapy that is absolutely dangerous.
Yes.
It's important to find the right person, so maybe your teacher or someone else you already know that can perform the correct way. It's not on YouTube. It's not on YouTube. It's on your own network of people they can do that.
That is really fantastic advice. So anyone who's listening and wondering, how do you get the best information, what Simone is describing here is absolutely perfect, is make sure you have a good teacher, someone that you can trust, someone who has established themselves as being an expert or being very competent in a particular area. And then when you have a trusted advisor or someone who's proven themselves, that really is the important person to learn from. And I do have one more question, Simone, which I think you've probably already answered, but what advice would you give to a young Simone who, 20 years ago, given your extensive experience now, what would be the one key piece of advice you would give yourself in developing your practitioner skills?
If in Italy, that's important, because I think there are some differences between Italy and other countries, of course. So, but I can speak about Italy. Yes. If in Italy, I will tell him, open your eyes, open your mind, and go abroad and learn from other experiences. meaning that after that you can go and start to treat your patients. But I think nowadays there are really, fortunately, several opportunities to do that also for Italians.
Yes.
But I think the advice I can give them is open your eyes and open your mind.
Because Simone, you have dealt with many different professions. I mean, it's the podiatry profession, for example, doesn't formally exist in Italy. So you have been a good demonstration where you've opened your mind and opened your eyes and dealt with many different professionals coming from different professions, haven't you?
Yeah, sure, absolutely sure. Actually, in a daily basis, I deal with, we can say, podologists here in Italy that are similar but not properly podiatrists, but
Yes.
abroad with the people from abroad, podiatrists, osteopaths, chiropractors, and I think it's a pity to find that there are too often fights, so they are fighting against one against the other. So
Yes.
I think it should be more valuable to cooperate between professions. And I think that biodiversity is the basis for evolution.
Yeah, I absolutely agree. But I think you've summed it up well in that the Italian spirit of fighting and expressing your opinions passionately might sometimes work against the professions. Well, look, Simone, look, I want to say thank you very much. Grazie mille for your generosity and your wise words that you've shared with those people who are interested in learning about FMT and developing their own professional skills. It really is a great pleasure to not only just catch up with you and have a chat, but to hear your wisdom and hear you share that. I'm really grateful for that. So grazie mille.
Grazie a te. Thank you so much for inviting me. It's a big honor. I'm honored by speaking with you, and I'm sorry for my bad English, but this is one of the very best Italian English you can listen all over the world. So.
Yes.
Thank you very much. Grazie mille.
Prego, prego, signor, prego, amico. Ciao, ciao.
Ciao.